Disorders of the tendons may vary from tendinitis, which is inflammation of the tendon, to bursitis, inflammation of the bursa. Tendinosis is a painful degradation of collagen fibers when the tendon by itself is degrading, and it causes pain at the same time. Tendinitis is inflammation of the tendon, and the tendon, as we know, it's a connective tissue that may attach muscle to the bone. It can occur virtually in any tendon, but most common tendinitis is in the shoulder joint. Tendinitis will happen, and again, we can blame the usual suspect, the overuse injury, and but also with age it can be caused, by calcium deposits. And again, overuse injury in athletes common, and it also may be associated commonly with bursitis. So how to diagnose? Patient will present with tenderness over affected tendon on physical exam, and pain when the muscle to which the tendon is attached and the muscle that is connected to the bone is in use. And or even if you put resistance against that movement, against that muscle, against that movement, patient may have pain, such as you trying to incarcerate the shoulder, and you're trying to prevent movement laterally, the lateral raises, and patient may have pain in the shoulder at that time. So if it's simple tendinitis, the treatment will be, again, rice type of rest and ice, and of course probably bandaging won't do any good or bad, but a patient also may benefit from analgesic medications, and again, anti-inflammatory and NSAIDs may be prescribed. Patient will benefit from physical therapy, range of motion exercises, of course, when patient's pain is under control. So some people will develop adhesions in joints, then most commonly patient may require surgical intervention to destroy the adhesions. Strengthening exercises, avoiding overuse, and will prevent this type of injury and tendinitis. Bursitis, on the other hand, is the inflammation of bursal sac. So what happens, again, the same suspect, the usual suspect, repetitive motion, overuse injury will result in bursitis. Again, any joint will be affected. Again, the shoulder is the most common type. In elbow, bursitis in the elbow will be called a tennis elbow, and most people who develop tennis elbow don't play tennis, but it's still tennis elbow. So what will happen? Severe pain, immobility because of the pain, and again, location, tenderness on palpation, X-ray testing. Again, you really truly want to do diagnosis of exclusion, but to rule out fracture. But again, rest, application of heat, analgesic, NSAIDs will help. Corticosteroid treatments can be used in extreme cases, and also surgical treatments. Again, physical therapy is the king in these situations, and really truly, if you think about this, how tendinitis and bursitis happens, it's inappropriate technique. With tennis players, it's usually you can have a coach who can correct it, but with household tools, with power tools, repetitive movements, it's inappropriate technique or weakness of the surrounding muscles. So again, physical therapy to strengthen the affected area by strengthening the muscles will certainly help. Although colloquially tennis elbow, most people will be calling a bursitis. However, truly tennis elbow is epicondylitis, and the difference is that epicondylitis is a type of tendinitis. It's an inflammation of the tendon in the place where it attaches to the bone. Again, tennis elbow, it's lateral epicondylitis. Golfer's elbow, medial epicondylitis. Again, overuse injuries. Again, principles described before may apply. Rest, physical therapy, steroid injections may help, and usually muscle strengthening may help as well. Muscle strains, one of the most common injuries, and it's severe stretch, that stretching beyond its normal capacity. So it's a local muscle damage and muscle strain, also tendon strain, and it's really fine line. You really, with common diagnostic techniques available in primary care, it's very difficult to distinguish which one is which, but muscle relaxants may or may not be prescribed in these situations, but again, principles of rest, correct techniques of use or movements, lifting should be implemented, and this can be avoided. Usually self-limiting condition and should improve with rest, analgesia, and muscle relaxers. Rhabdomyolysis is a life-threatening condition, and it may be related to severe trauma, severe muscle trauma, and muscle cell loss. What happened in this case, when the content of the damaged muscle released into circulation, myoglobulin, and it will be clogging the kidneys, clogging the tubules, and creating kidney damage. At this point, it's becoming an emergency and needs immediate treatment. So what can be done to prevent it? To prevent it, we need to be sure that people who are prone to the injuries like that, like fall injury or crush injury, will not sustain those. Other risk factors involve alcoholism, use of cocaine, heat stroke, ischemia